Is it safe to extubate a weak ICU patient? Preventing reintubation tips. My name is Patrik Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, control, power, and influence, making sure your loved one always gets best care and treatment, even if you're not a doctor or a nurse in intensive care. So today I have a question from Christopher, who's one of our clients and members, and he says, "Hi Patrik, I was at the hospital this morning and my mother completed another 2-hour spontaneous breathing trial. The ICU team says she looks good. We could not get a blood gas yet. However, she's very weak, possibly more so on her left side. The doctor has ordered another CT scan for today. That might delay the extubation until later today, but the ICU nurse said she still anticipates they will go forward with the extubation today. Do you think it's okay to extubate my mom, knowing she is very weak?" So Christopher, this is a great and very important question that comes up all the time when families contact us here at intensivecarehotline.com. Now, the goal with any ventilated patient is to extubate safely, meaning your mother should be strong enough to breathe on her own without getting reintubated. Reintubation carries significant and serious risks, including airway trauma, pneumonia, and prolonged ICU stays with the risk of needing a tracheostomy. The goal is always to extubate as early as possible, avoiding the tracheostomy. If your mother is weak, the ICU team needs to take that into account and make sure there's a comprehensive plan to support her breathing after extubation. The good news is that your mother must meet some criteria for extubation, where that is sedation must be off, opiates must be off, she must be obeying commands, she must have a good cough and gag reflex, otherwise they wouldn't even consider extubation. Now, let's look at key evidence-based strategies that can help prevent reintubation. Number 1, BIPAP, which is bi-level positive airway pressure. This is often used to immediately prevent reintubation after extubation, especially for weak patients or those with COPD, asthma, heart failure, or respiratory muscle weakness. BiPAP provides extra support to help your mother maintain adequate ventilation, oxygenation, and also CO2 management while she regains her strength. One of the biggest risks after extubation can be that patients retain CO2 or carbon dioxide, and BiPAP will help to manage that. Number 2, CPAP, which is continuous positive airway pressure. CPAP can help keep the airways open and prevent airway collapse, reducing the risk of reintubation, atelectasis, pneumonia, particularly if your mother has sleep apnea or upper airway weakness. Number 3, high-flow nasal cannula. High-flow nasal oxygen therapy can be used as an alternative or in combination with non-invasive ventilation such as BiPAP or CPAP. It delivers warm, humidified air and oxygen at high flow rates, providing both comfort and respiratory support. Number 4, chest physiotherapy. Regular chest physiotherapy helps clear secretions, improves lung expansion, and enhances oxygenation. It's especially important in weak patients who may not have an effective cough. And number 5, early mobilization, getting your mother out of bed as soon as possible, even sitting in a chair. Doing passive exercises can make a massive difference. Mobilization improves lung function, prevents pneumonia, and builds the strength needed to breathe independently. All of these strategies should be part of a structured weaning and extubation plan, especially in patients with weakness or neurological deficits, as you mentioned with the possible left-sided weakness for your mom. If the ICU is rushing to extubate without a clear plan for post-extubation support, that's a red flag. Families often tell us they feel pressured to just go along with whatever the ICU team suggests without fully understanding what it actually means. But remember, you can, you should, and you need to ask questions and request evidence-based care. You also need to get access to the medical records so that there's every ounce of transparency that your mom's stay in intensive care needs, so that you can have us to look at the medical records, give you a second opinion, and also making sure that the intensive care team is doing everything beyond the shadow of a doubt to help your mom get extubated successfully. If they miss one critical step, it could fail, right? So how can you check whether they've missed a critical step? I've made a video a while ago, how to wean a critically ill patient off the ventilator and the breathing tube. And I'll link towards it in the written version of this blog so that you can have a listen or a watch there, what the intensive care team needs to do. Also, another important factor is make sure that it's not a quote unquote one-way extubation, right? If it's a one-way extubation, the plan might be to extubate your mum, but not to reintubate in case it fails. That is often a death sentence. So again, be clear on what the plan is. You can't go into those situations blindly because they are life or death situations, and you need an advocate by your side, which is exactly what we do here at intensivecarehotline.com, where we can help you review your mother's situation in real time, look at her arterial blood gases, ventilator settings, test x-ray, and advise whether she's ready for extubation, or if more preparation is needed, or if the ICU team wants to do a one-way extubation, we'll help you to turn that around, just as we have turned around so many situations. We have saved so many lives for our clients in the intensive care. It's all documented on our testimonial section at intensivecarehotline.com, and also on our intensivecarehotline.com podcast with client interviews. The goal is to prevent reintubation and get your mum safely off the ventilator, whether that means a short run on BIPAP, CPAP, high flow nasal prongs, or waiting until she's a little bit stronger. And if your mother, God forbid, ends up needing prolonged ventilation with a tracheostomy, remember that with the right support from intensive care at home, she can be safely looked after at home by 24/7 critical care trained nurses, following the evidence-based mechanical home ventilation guidelines that are linked towards in the written version of this blog. If you have a loved one in ICU and you need help making informed decisions, avoiding ICU mistakes, or getting a loved one home safely, go to intensivecarehotline.com and book a confidential consultation with me today. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.